Alright guys, so I'm going to tell you about 3 interesting cases I had this week of different manifestations of an allergy to cow's milk. I'm Dr. Imam. I'm a board certified allergy, asthma, and immunology doctor, and I often treat food allergies. So the first case was pretty typical. I had a 14-month-old female coming in with a history of eczema and a history of egg allergy, and upon consumption of milk, just drinking raw milk, vomited once and then broke out in hives. Parents treated with an antihistamine and the child just fine. Came to the office, got a skin prick test, positive to cow's milk, got a blood test, showed an allergy to casein protein and whey protein, which is highly predictive that the cow's milk caused the allergy. Main treatment options for an individual like this would be avoidance and waiting to see if they outgrow it so they can repeat testing in 6 months to 12 months, or the possibility of sublingual or oral immunotherapy to try to desensitize to food allergy. The second case was a 25-year-old gentleman coming in with episodes of vomiting and abdominal pain and heartburn that just doesn't remit. Went and saw a GI doctor, got scoped, got biopsied, and found out to have eosinophilic esophagitis. The GI doctor ordered a blood panel for food allergies and came back negative to everything. Was started on a PPI, which is a heartburn medication like omeprazole. Was not doing much better, was started on a steroid. He came to see us for testing for food allergies. He was informed that the blood testing for cow's milk allergy is unreliable when it comes to eosinophilic esophagitis, and was asked to remove milk protein from their diet, and reports feeling a lot better about 2 to 3 weeks later, and has continued to remove milk from their diet. The last case, we had a child that was around 4 years old coming in with intermittent episodes of acute nausea and abdominal pain with vomiting occurring about half an hour after certain meals. Because the reactions were happening so quick after a meal and there was no abdominal pain and no vomiting outside of the meals, it was suspicious for a potential food allergy, so they brought in a food diary. We skin prick tested them and they were positive to cow's milk allergy. They had blood testing that confirmed an allergy to whey protein. It appeared that the child was having baked milk, baked eggs, and yogurt as their primary dairy sources, and the whey was processed, therefore they were tolerating those foods well. But whenever they had something with raw milk or the milk wasn't well processed, they started having a reaction, but it was very mild, just vomiting. And then upon removal of the dairy, they did a lot better. So those are 3 kind of different manifestations of how a cow's milk allergy could present. There's even more. There's cow's milk protein allergy. There's eosinophilic gastroenteritis, there's FPIES, there's lots of different ways the same allergy can present, and it can be very different in different people depending on the allergy that they have, the protein in the milk that they're allergic to, how the milk is processed, and then any other underlying health conditions that they might have. So no 2 food allergies are the same, even if the same food. I hope that helps.